Learn the most important lab values.
RBC, red blood cells. Normal range, 4.5 to 5.5 million cells per microliter. RBCs are responsible for carrying oxygen throughout the body. Hemoglobin. Men, 14 to 18 grams per deciliter. Women, 12 to 16 grams per deciliter. Hemoglobin is the oxygen-carrying protein found inside red blood cells. Hematocrit. Men, 42 to 52%. Women, 37 to 47%. Hematocrit represents the percentage of blood occupied by red blood cells. Platelets. Normal range, 150,000 to 400,000 per microliter. Platelets help in blood clotting. WBC, white blood cells. Normal range, 4,000 to 10,000 per microliter. WBCs play a major role in fighting infections. PT, prothrombin time. Normal, 10 to 12 seconds. Used to assess the extrinsic pathway of coagulation. aPTT, activated partial thromboplastin time. Normal, 25 to 35 seconds. For patients on heparin therapy, it may be prolonged to 30 to 70 seconds. INR, International Normalized Ratio. Normal, 0.9 to 1.2. Patients taking warfarin generally have a therapeutic INR of 2 to 3. D-dimer. Normal value, less than 300. An elevated D-dimer may indicate thrombosis or pulmonary embolism. Myoglobin. Men, 28 to 72 nanograms per milliliter. Women, 25 to 58 nanograms per milliliter. Troponin I. Normal, less than 0.1 nanograms per milliliter. Troponin T. Normal, less than 0.03 nanograms per milliliter. Troponins are highly specific markers for myocardial infarction or heart attack. Creatine Kinase, CK. Normal, 30 to 170 units per liter. Used to assess muscle injury. GFR, glomerular filtration rate. Normal, greater than 90 milliliters per minute per 1.73 square meters. Creatinine. Normal, 0.6 to 1.2 milligrams per deciliter. Creatinine is an important indicator of kidney function. BUN, blood urea nitrogen. Normal, 10 to 20 milligrams per deciliter. Elevated BUN may indicate kidney dysfunction or dehydration. Total cholesterol. Normal, less than 200 milligrams per deciliter. Triglycerides. Normal, less than 150 milligrams per deciliter. LDL, bad cholesterol. Normal, less than 130 milligrams per deciliter. HDL, good cholesterol. Normal. Greater than 40 milligrams per deciliter. pH. Normal, 7.35 to 7.45. PaCO₂. Normal, 35 to 45 millimeters of mercury. HCO₃. Normal, 22 to 26 milliequivalents/L. SpO₂. Normal, 94 to 100%. PaO₂. Normal, 80 to 100 millimeters of mercury. ABG analysis helps assess respiratory and metabolic status. Fasting blood glucose. Normal, 70 to 100 milligrams per deciliter. HbA1c. Normal, less than 7%. Fasting blood sugar between 100 and 125 milligrams per deciliter indicates prediabetes. A fasting blood sugar of 126 milligrams per deciliter or higher indicates diabetes. AST. Normal, 0 to 35 units per liter. ALT. Normal, 0 to 35 units per liter. ALP. Normal, 36 to 150 units per liter. Bilirubin. Normal, 0 to 0.8 milligrams per deciliter. Albumin. Normal, 3.5 to 5 grams per deciliter. Total protein. Normal, 6 to 8 grams per deciliter. Sodium. Normal, 135 to 145 milliequivalents/L. Potassium. Normal, 3.5 to 5 milliequivalents/L. Calcium. Normal, 8.5 to 10.5 milligrams per deciliter. Chloride. Normal, 98 to 106 milliequivalents/L. Magnesium. Normal, 1.3 to 2.1 milligrams per deciliter. Phosphate. Normal, 2.5 to 4.5 milligrams per deciliter. These were some of the most important laboratory values that every healthcare professional should memorize.